My name is Rafael, and today we will work on soothing the mind after interacting with patients. Whether you're a nurse, doctor, therapist, or support staff, it is important to regulate the nervous system after dealing with patients. When we ignore our body's signal for rest, we burn out over time. It is imperative that we learn to calm our nervous system after being in such a highly stimulated environment. This is the time to unwind, let go, and be present. To start today's practice, come to a comfortable seat, on a chair, on a cushion, or lying down. Begin to bring awareness to the breath. Natural rhythm without trying to change anything at first. Simply notice the breath going in the nose and out the nose or mouth. Briefly scanning from head to the toes, noticing any areas of tension where you may have accumulated stress during your shift. Noticing without any judgment, is there anywhere in the body feeling tight or stressed? Remember, when you give your energy to those that are sick, you must refill your own cup. Meditation is a beautiful tool to realign your energy through your breath, allowing you to serve without burning out. We cannot give what we do not have. We cannot pour from an empty cup. Refill your cup of energy so you can continue to serve your community. The way we fill this cup is with the breath. Deep breathing in through the nose, feeling the cool air through the nostrils. Holding, release, HA, sigh it out. Again, good. In through the nose. Pause at the top. HA, sigh the energy out. Softening the shoulders, releasing tension, letting go of the day. One more time, in through the nose. Slow and steady, holding. Release, HA, long and heavy. Release all the air from the lungs. Continue a few more breaths like so. Try to be present and be here. Release any interactions you may have had of the day. Let go of all the beeping, alarms, yelling, and just settle into the breath. Watching the inhalations and the exhalations. When we sit in silence during meditation, it is normal for scenes of the day to replay in the head. This is how we process emotion and unwind. When the mind drifts toward these scenes, whether they are good or bad, acknowledge the thought and then redirect your focus towards the deep breathing. Use the breath as the awareness point to calm the mind. Do your best not to feed your energy, your attention to heavy thoughts, to any arguments. any mistakes you have made during your shift. This is the time to be here. Not to suppress thoughts, just to acknowledge them and breathe. The more present you are, the more calm you will feel. If you work in a highly stimulated environment, it is normal for the body to be in a sympathetic state, meaning activated in a fight, flight, or freeze mode. When this happens, when you are constantly under stress of the job, your heart rate is elevated, your system is on overdrive, your blood pressure is raised, and your breath is quickened and more shallow. When you get off your shift, it can be very hard to shift the body towards that parasympathetic state, that relaxed rest and digest mode of the breath. This deep breathing in through the nose and out through the mouth is signaling the body to relax, turning off those stress hormones such as cortisol and adrenaline, allowing you to reset the nervous system, avoiding burnout. Bring your hands out in front of you and slowly shake the hands away from you as if you were flicking water off your fingers. Shaking the hands and breathing, releasing stress from the day, emptying the cells of any stress accumulated in the biocellular memory. Shaking the hands, breathing, letting go. If you feel comfortable, you can shake the legs as well. A proven exercise to release any anxiety. And then come to center, bringing one hand on the heart, one hand on the belly. Try and find stillness with the hands, with the body, and notice the breath as you're inhaling through the nose, how the belly rises, expands, as well as the chest, and then release the breath. Noticing, watching the breath in through the nose, expanding of the belly and the chest, and exhale through the mouth, sinking of the chest. Filling the body up with energy, noticing the breath going through the body to every corner, sending healing energy, bright light, calm ease. When the mind wanders, forgive yourself, focus back on the moment. Any worries, to-dos can take place later. Be here for another few minutes, focusing on you, refilling your own cup so you can serve. And feel yourself becoming ever more relaxed with every breath, not trying to force any sensation. If ease and calm comes to you, allow that feeling to wash over. Really settle into that feeling. if it's not coming to you, that is okay, that is normal. Continue breathing, focusing on the present moment, and maybe with time that feeling will come. As always, try to soften the shoulder. Let go of any tension you're holding on to in the body. Find the power in your breath. Nowhere else to be, nothing else to do, but breathe. You are doing great. You are exactly where you need to be. Focusing on yourself for a few more breaths. You can release the hands on the thighs, taking the last few moments here in this silent space. Remembering that this breath is always available to you. Even when you're running around during your shift, busy, stressed, understanding the dysregulation of the nervous system. How when we are stressed, the breath becomes short and shallow, and how the brain becomes stressed due to that lack of oxygen, initiating that sympathetic response. Even when you are busy and running from place to place, patient to patient, remembering to breathe, deep full inhalations in through the nose, out through the mouth. Calming your nervous system even on the go. You hold the power, you hold the control. And when you feel ready, noticing any sounds around you, becoming aware of how the body feels. And when you feel ready, opening the eyes, taking in your surroundings slowly, and finding gratitude for yourself for practicing filling your own cup. Thank you for practicing with me. I look forward to sitting with you again.